Hello, my name is Ashwin Sridhar. I'm a consultant urologist. And as a urologist, I specialize in conditions of the kidney, bladder, and prostate. I'm recording a series of videos to provide some information regarding common conditions that you might come across when you are looking for a urology specialist. Please feel free to go to the videos and come and see me if you would like to discuss any of these further. Bladder cancer is a common type of cancer. It is among the top 10 most common types of cancer. And usually you might notice that you have bladder cancer if you have blood in the urine or infections that just don't go away, or if you've noticed a loss in weight. Now, the first steps in diagnosing bladder cancer include seeing a specialist like myself, where we talk through your symptoms, do an examination, do some blood tests and a urine test. We will then proceed to do some scans, which is usually a CT scan of the kidneys and the bladder. And if we find something, we will also proceed to do a camera test or a cystoscopy. At the cystoscopy, if we find something, we will proceed to take a tissue sample or a biopsy. And we may proceed to scrape away all of as much as we can see from inside the bladder. This is usually the first step in the diagnosis and treatment for your bladder cancer. Whatever has been taken away from your bladder is usually sent to the lab for us to see if this is cancer and how active the cancer is and where it is. Once we have this information, we will see you back in clinic and we will talk to you about the various options of treatment for bladder cancer. Broadly, bladder cancer can either be classified as early and superficial, otherwise known as non-muscle invasive bladder cancer. Usually, we can watch this with regular camera tests, or we can offer treatments into the bladder to treat the bladder so it doesn't come back. If we find muscle invasive bladder cancer, where the cancer has gone through the lining of the bladder into the muscle and beyond, this will need radical treatment, usually with removal of the bladder, which is called a cystectomy, or radiation to the bladder. Both of these treatments are usually given along with injection of drugs into the veins called chemotherapy or immunotherapy. If you are ever worried about a diagnosis of bladder cancer or its treatment, please come and see me and we can discuss this further and take your management forward together.